As soon as we walked into the emergency room, they were waiting for me. They put me on a table. The surgeon was waiting, and he said, "We're going to cut you from here to here. We're going to do this and this." I said, "You know, it was just some fluid on my heart, I assumed." I said, "Aren't you just going to use a needle?" He said, "No, no, no." He said, "This is real surgery." So at that point, you start to... I'm laying on a hospital bed, and my wife comes in, and you don't know. She says, you know, "Don't worry." But this was different. I've had several procedures with my brain. I've had several procedures with my brain, but this time it's your heart. It really got to me that day. So, you know, she gives me a hug. We go in the operating room. Next morning I wake up, and they give you all kinds of drugs, so you have no idea where you are. So I wake up in the morning, and Eileen's standing by my bed, and I said, "Where am I?" She said, "You're in the hospital." And I said, "Why?" And I looked down, there's wires, tubes coming out of me everywhere. And then you realize how, you know, lucky you are, and how God gave me another chance, which is an amazing feeling, and it's difficult to put into words.
For me, it's been 3 years since discovering, quite by surprise, that my heart murmur wasn't a heart murmur. It was severe aortic stenosis. And so I went from also having been given a good report at my annual physical to finding out that I needed to have an aortic valve replacement very quickly. There's an emotional response that's very profound, because it is the one thing that, if it didn't go right, you wouldn't be here to share anything with anyone. The experience of cardiac care here in Western New York, and the discovery of what the resources are available to us in the community was just eye-awakening. I had no idea the depth and breadth of resources that we have available to us right here in Western New York, and the quality of care, and that exists as a testimony of the commitment of our community to develop and invest in these resources, and it's a testimony to all the people in this room for supporting the American Heart Association in this event and all the other activities relative to heart and stroke.
Dr. Bates is a mentor, a colleague, a friend. He's quiet, soft-spoken, but he has tremendous character and passion to what he does. And what he does is to evaluate TIAs, or mini strokes, and strokes, and how it's associated to the heart. He's the only physician I know, as a neurologist, who has gone away learning about the heart by taking courses, by being an imager of the heart and brain.
He developed a model where, when early symptoms occur, despite very significant risk factors, he was able to reduce the future progression to a real stroke very, very significantly, better than anything that's been reported in the literature so far. In fact, next, in the recent weeks, there has been an American Academy of Neurology meeting, and at that meeting, he and his team have presented those very significant reductions in the stroke.
And he's taken steps at a national level to publish and to present his research on how to treat TIAs, or mini strokes, in an outpatient setting, not only in a cost-effective way, but in an appropriate way, So it's very interesting, his work, and I'm proud to say that he'll be here tonight accepting his award, and I'm honored that I'm able to be here with him.
From Dr. Levy's guidance, one of our main things is constant community outreach, education, and discussion. In line with the American Heart and American Stroke, one of the major focuses and guidelines of the program is education and awareness. It's scary to admit that some of our zip codes in this area have a increased risk of stroke on the order of 200% the national average.
I've had the pleasure of working side by side with Dr. Levy for 10 years, and I have seen him grow in many ways and watched his vision become a reality. I have to say I'm very proud of him, and I love my job and I love working alongside of him.
Over the years, watching his ability to develop a program, a stroke program, with his colleagues has been nothing short of remarkable. He's a credit to our profession as physicians, and certainly a model for us to use, if you will, or emulate in creating other advances in care for our patients in Western New York.